Lucentis it's called an anti-VEGF drug. So what it does, it helps to reduce leakage and fluid at the back of the eye to treat conditions such as wet macular degeneration, diabetic maculopathy, retinal vein occlusions. We use it in a lot of eye disease, and the aim of the drug is to try and maintain vision or improve vision. In patients who present with macular degeneration, they get bleeding at the back of the eye. So it's essential they present as early as possible so we can treat them as early as possible. The longer they have the bleeding at the back of the eye, they can develop scar tissue. And it is at this point, when they've developed scar tissue, it may be too late to treat them with Lucentis. So it is variable how many Lucentis injections people need, and also varies with the condition. People who have diabetic eye disease and vein occlusions usually need fewer than those with macular degeneration. We normally give the first 3 as what's called a loading dose. So we give 1 every month. And after that, we try and extend the treatment. So doctors might call it a treat and extend system. So where they have the injections every 6 weeks and then try and delay it every 8 weeks. On average, for your first year of having Lucentis, you should expect about 7 to 8 injections. So there are some people who don't do very well from Lucentis, and that is when, for example, they've had a very aggressive disease or they presented very late. There's always risks with any treatment given. So we always say to patients, there's a 1 in 1,000 risk of loss of vision from an infection or a bleed. There's also smaller risks with the injection, such as 1 in 100 of getting raised pressure in the eye or getting inflammation in the eye. Sometimes people have a course of Lucentis and they stop responding as well after a while, in which case we can swap the treatment to another one called Eylea, which is very commonly done. And we find that when after changing people into a different treatment after a period of time, they continue to respond as well. It varies among people, but I have seen people come in 7 days after the injection with the resolution of the fluid that they had at the back of the eye. So I would say within 7 days, you can see it working. Unfortunately, we do advise people not to drive straight after the injection because doctors normally like to put dilating drops in the eye, which will blur the vision. Also, when you've had a procedure done, you can be unsettled, and it can affect your judgment. So we advise people not to drive. It's the same when people have lost their vision in one eye suddenly. We advise them not to drive, even if the other eye is very good, for a period that it takes for them to accommodate to the new vision.